Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In this video, we're going to talk about disorders that have conduct problems. So the two primary disorders we're going to discuss are oppositional defiant disorder and conduct disorder. By the end of this video, you should be able to determine some of the commonalities and some of the distinctions between the two. So without further ado, here we go. Oppositional defiant disorder is deemed as when a child is behaving in an age inappropriate, stubborn, hostile, and defiant way. Usually we see symptoms by the age of 8 years old. The hallmark feature of oppositional defiant disorder is the inability to embrace an authority figure. So there's oftentimes losing one's temper when being told what to do, arguing with adults, whether it be one's parents or teachers or so forth, actively defying or refusing to comply with what is being asked or told, intentionally annoying other people, blaming other people for one's misbehavior, being hypersensitive to criticism and easily annoyed, having resentfulness, anger, spitefulness, and vindictiveness. So that is oppositional defiant disorder. So the hallmark features are rebellion from authority, not being able to receive an authority figure's direction. Whereas conduct disorder, this is more of a violation of the basic rights of another person or disregarding standard rules of society. So in addition to defying authority figures, there might be aggression towards people or animals, such as bullying or cyberbullying or threatening or fighting or torturing animals. You also tend to see destruction of property, whether it's in an attempt to intimidate, or sometimes it could be arson or fire setting. We also see deceitfulness and theft. So there's shoplifting, breaking into other people's property, manipulating other people in order to get what you want, and so forth. And then there's the basic violation of standards of conduct, such as running away, truancy from school, staying out beyond permission, without people knowing where you are. So that's the conduct disorder. So conduct disorder is a more intensive, more severe situation where the child is deviating from what's considered socially acceptable. Now, we also need to differentiate between child onset conduct disorder versus adolescent onset conduct disorder. So child onset conduct disorder is when you display one or more of these symptoms before the age of 10. In this case, we see that conduct disorder that is childhood onset is more likely to be males or boys. There is a form of physical aggression involved, and we tend to see antisocial behavior persist through time. Whereas adolescent onset conduct disorder, the symptomology is equally prevalent amongst girls and boys. We don't see the level of severity of psychopathology as in the case of early onset. And these individuals are less likely to commit violent crimes or persist with antisocial behavior over time. Now, the way I conceptualize these two disorders is there is a pipeline. More often than not, we see children start with oppositional defiant disorder, and some of these children will transition to a more severe version called conduct disorder, And some of the children with conduct disorder will maintain that into adulthood. And there's a disorder called antisocial personality disorder, which we will talk about in another video. But that's generally the developmental pathway. Does that mean that every case of conduct disorder started with oppositional defiant disorder, or every case of antisocial personality disorder started with a diagnosis of ODD or conduct disorder? The answer is no, it's not every case, but that is a common developmental pathway. So, as I said, we see most cases of conduct disorder are preceded by oppositional defiant disorder, but not always, right? So there are many individuals with oppositional defiant disorder who never progress into conduct disorder, right? So yeah, there's a nice portion of people who have conduct disorder that started with ODD, but many people with ODD, they learn to regulate their emotions and their behavior comes in line with what is acceptable, and that's fine. And then when we talk about the pathway from conduct disorder to antisocial personality disorder, which I just mentioned, we see about 40% of individuals with conduct disorder develop antisocial personality disorder. And that too is important because not every individual who displays conduct disorder in childhood is going to adopt this personality disorder. Now, what is antisocial personality disorder? This is a more pervasive pattern of disregard for and the violation of the basic rights of others. And more often than not, it includes illegal activities. So what are some of the associated characteristics with oppositional defiant disorder and conduct disorder? What we tend to see is that in general, cognitively speaking, there's normal IQ, but there's about an 8-point difference between the general population and the individuals with oppositional defiant or conduct disorder. We also see that there's the potential for language problems. And if we were to give an IQ test, one's performance-based IQ tends to be stronger than their verbal IQ. So we do see that there are some language deficits that are present before conduct problems. And perhaps some of these conduct problems are frustration, not being able to articulate or express what one is feeling. Now, academically, we do see an underperformance and underachievement in the classroom, especially on verbal skills. And we do see a connection between ADHD and oppositional defiant disorder and conduct disorder. So there is this overlapping diagnosis that can occur, as we mentioned in the video on ADHD. So what about self-esteem? Low self-esteem is not a contributing factor to oppositional defiant or conduct disorder. Oftentimes, individuals with oppositional defiant conduct disorder have more of an inflated sense of self-esteem, but it's unstable. So that instability in the sense of self can be an issue long-term, especially when we talk about antisocial personality disorder. So that's self-esteem. And then what about peer relationships? We see, especially with conduct disorder, there's verbal and physical aggression towards one's peers. We see social isolation. We see peer rejection. So when your peer group rejects you, you're going to find other people who will accept you. And more often than not, that is identifying other people engaged in antisocial behavior. And so your peers tend to be involved in antisocial acts as well. And if we were to evaluate self versus the other, there is a bias to overestimate other people's aggression and underestimate one's own aggression. And in terms of empathy, we see a lack of concern for others. Now, family problems are part of the issue. We tend to see people with oppositional defiant disorder and conduct disorder tend to have a lack of family cohesion. There's a lot of strife or conflict, and there's a lack of emotional support. Many of the parents struggle with raising children who have oppositional defiant disorder and conduct disorder. So they're deficient in parenting practices. They struggle with communicating with their children and oftentimes resort to more harsh punishments as a function of not being able to address the issue. So I already mentioned rates of conflict and marital discord. We also see that these features do run in families. So if you have a family history of antisocial behavior or psychopathology, you're going to have higher rates of conduct disorder or oppositional defiant disorder. Same thing with family instability. So what are some of the outcomes? Well, unfortunately, oppositional defiant disorder and specifically conduct disorder, more importantly, has a 3 to 4 times higher rate premature death rate. So getting involved in those antisocial behaviors is going to put you at risk of self-harm or other people harming you. So we also, like I said, see higher risk of personal injury. We see higher rates of sexual activity and risky sexual activity too. We see more willingness to have one-night stands, unprotected sex, and so forth. And in adolescence in particular, we see a spike in the rates of drugs and alcohol. Now, we mentioned this earlier in the video, oppositional defiant disorder and conduct disorder do have frequently co-occurring conditions, things like ADHD, which I mentioned, but also depression, whether it be a major depressive disorder, bipolar depression, and anxiety conditions. So what is the prevalence of conduct disorder and oppositional defiant disorder? The prevalence of oppositional defiant disorder, I'll go first, is about 12%. And it's about 2 to 6% for conduct disorder. So oppositional defiant disorder is far more common than conduct disorder because it requires a more severe violation of basic rights and norms in society. Now, in terms of antisocial behavior, we do see in childhood boys have higher rates of these conditions, but by 15, the differences between boys and girls disappear. In terms of aggression or violence, boys tend to be more physically violent or violence prone, whereas girls tend to be more indirect or have forms of relational violence or verbal aggression. So this is pretty much the epidemiology. So as I said, there are different pathways. The traditional pathway is the life course persistent pathway, which we mentioned. You start with oppositional defiant disorder, leads to conduct disorder leads to antisocial personality disorder. So that would be life course on that developmental pathway. But I mentioned that not everyone follows that path, right? Some people with oppositional defiant disorder, you know, they figure out what's going on and they never transition to conduct disorder. And then some people with conduct disorder never transition to antisocial personality disorder. So we do see another pathway, which we refer to as an adolescent limited path, which these deviations start right around puberty and it ends in young adulthood. So it's contained between, I'm throwing out numbers, roughly 12, 13 to about 25, and then it's figured out. And The life course persistent pattern is far more problematic. You have far more issues with the legal system, and the life course persistent is much harder to treat, whereas the adolescent limited one is more common and it's less severe and it's easier to treat. So that is a very quick differentiation between oppositional defiant disorder and conduct disorder. We talked about some of the commonalities. We talked about some of the differences. We talked about the epidemiology. We talked about the developmental pathways that this can take. So if you like this video, please give me the thumbs up, hit the like button, click the notifications tab as well. And if you have anything in particular, a question or a comment that you want to add, please put it in the comment section. I read every comment. Until next time, take care, everybody.